So, Marni, thank you so much for joining the Handcrafted Therapy Podcast today. I am so happy you're here. Marni and I go back a few years. She and I used to work at a spa together, what feels like decades ago. But, we're too young to say that, right?
Probably only 1 decade ago.
But thanks for joining us, Marni.
Thank you. I'm honored to be here. Thank you, Julie.
Yeah. And Marni and I both teach. We both have the pleasure of teaching at Kikino Institute of Healing in Plano, Texas. Tell us a little bit about what you do at Kikino, Marni.
Well, I teach CEU classes and I work in the master clinic. So that's our highest clinic level. And it's been such an honor to really be stretched in that capacity. The cases that we get there are some of the most complicated medical cases, some of the most challenging, some of the most frail or delicate people. And it's just really amazing. I never knew that my career would go this direction when I started out in medical massage back in the day.
That's amazing. I know Kikino is very, very happy to have you. And I know the students are blessed to learn under your tutelage. And we have a couple of classes that we're hosting at Handcrafted Therapy with Marni as the instructor that we wanted to talk a little bit about today. Do you want to discuss those now?
Oh, sure. I'm super excited. So we're doing an introduction to craniosacral therapy and a pelvis class. The cranial class I'm super excited about. I consider that a fundamental skill set in being able to palpate the subtle rhythms in the body. So I teach my students light touch body work primarily, and sometimes light is deep, but we do a lot of myofascial, lymphatic, energy work, and craniosacral is feeling the cranial rhythm. So would you like me to sort of describe what craniosacral therapy is, Julie?
I would, very much so. In layman's terms, if you would.
So in high school biology, we're taught that the bones of the cranium are fused in adulthood. That's not entirely true. What we found is that the bones of the cranium actually move like the breath. So the cranium will elongate and then widen at a rate of about 8 to 12 cycles per minute. And that movement can be influenced by the respiration, by the breathing, but it is an entirely different movement. The current theory is that the cranium changes shape as the cerebral spinal fluid changes in pressure. So if you imagine that the cerebral spinal fluid that bathes the brain and the spinal cord is constantly produced. And as the brain produces more and more and more fluid, it creates tension and the cranium widens. It will get larger effectively. And then there's a nerve in the parietal suture. Here's my parietal suture. Here's my brain. Right on top here, there's a nerve that is postulated that when the pressure gets to be enough, that nerve will feel that strain and it will shut off production of the cerebral spinal fluid. And so as the pressure starts to decrease, as the fluid drains, it will start to produce more. So it's this cycle of on and off and on and off. As the changes in the cerebral spinal fluid cause the cranium to elongate and then widen and constantly change shape, this also affects the rest of the body. So if you can imagine the fascia. A fascia is this network of connective tissue all throughout the body. It surrounds every muscle fiber, every organ, every bone, and goes actually into the bony structures, the osseous structures of the body. So as the cranium changes shape, it also affects the dura, the covering of the spinal cord, all the way down to the sacrum. The sacrum is that triangle-shaped bone at the base of your spine, right between your hip bones. And as the cranium changes shape, the sacrum rocks. So it rocks with that same motion as the cranium. And interestingly enough, the extremities also move. So the legs and the arms will elongate and rotate outward and shorten and rotate in. We can even feel this motion in the fingers and the toes. So the whole body has this cranial motion. So craniosacral therapy is, at a basic level, manipulating the bones of the cranium to find the optimum freedom of movement and optimizing the movement and the flow of the cerebral spinal fluid. At an advanced level, it's a full body treatment. Full body, we're analyzing how that cranial movement is working in different parts of the body and using light touch, 5 grams of pressure, which is the weight of a nickel, or the amount of pressure you might put on your eyeball if you were to try to push on your eye. That's about as much pressure as we use typically in craniosacral therapy. So in the class that I'll be offering, it's only 2 days. And if you're aware of some of the other major organizations like Upledger that teach craniosacral, their introductory class is 4 days. And it is fabulous. I highly recommend it. And I've actually scheduled this class after Upledger comes. Like, if you don't take their class and you just want an introduction, then come and take mine. And it's also the basic skills that I want my students to have. So you may know I mentor students at Kikino, and we do a lot of tandem work with those students. And when they're working with me, I would like for them to have some basic skills. So in this class, we will have a few things that can be used to treat clients immediately when they go back to their office, but it's also a tool to help to train their hands. So with any new modality, especially craniosacral, it can be so vast. I mean, I've had, I think, 200 hours of classroom training now in cranial, and there's a lot more that I could take. But it's important as a practitioner to learn to feel. So the techniques that I'll be showing are things that you can do right away to provide value to your client, but also to train your hands. So as you decide to progress in this work, the next training class will be easier. And I would expect that the students would get it. They would get more out of it. I actually delayed taking my first craniosacral class at Upledger because I had taken a level 1 at my massage school. And I did not want to have to retake level 1. I just thought that was ridiculous. But I finally realized I had to if I wanted to get into the upper level courses. And I did. And I was amazed that it was actually really good for me to have that review and to see how they taught it again. And I picked up little pieces along the way. So it's not lost. It's still helpful.
I loved the way you described CST. I think that's palpable for our listeners to take a bite off of that. And, a lot of times I've heard CST be described and it just feels like you're talking about something from outer space. I mean, like you're listening to the cranial rhythms. And I mean, it just feels like kind of, a little more, what am I trying to say? Like a little less palpable to the hands and more like something an idea that you have to think about.
Right.
No, it's kind of hard as massage therapists, or maybe it was just hard to me to actually like absorb this idea that there's this craniosacral rhythm that you can feel from your fingertips when you're working on somebody. Because it's very light. Like you said, 5 grams of pressure is just so light. It doesn't even feel like you can do much to help somebody with that. But I know that you have a lot to say when somebody says that.
I do. It's almost energy work. Mm-hmm. It's almost just intuiting. If I invite this suture to change, or if I invite this bone to move in a certain way, will it do it? And 9 times out of 10, it will. I'm not going to say there's not occasions like after I had COVID when I needed a little bit more than 5 grams, maybe 15. But that's still incredibly light touch to get the cranial bones to move. But you're right. It is something that people really don't understand. And honestly, the touch is so subtle. It's so light to feel those subtle movements that people that aren't accustomed to feeling into their own bodies, it often takes them a little while. It takes me usually most of the first day to get the whole class feeling the cranial rhythm, because that is a very different way than we're accustomed to working. Energy workers tend to pick it up faster. People that are using a lot of deep pressure tend to pick it up slower, but we all can learn it. It's all available. And what happened with me is when I first started feeling it, It felt like it was my imagination. It felt that light. I literally thought I was imagining it. And then I had a trainer come up and hold the legs of my client and feel the rhythm at the legs and tell me what I was feeling at the head. And that was the thing that like set off that light bulb for me. Oh, okay, I'm really feeling it. So that's some of the things that we offer in this class is being able to go around and confirm that, yes, this is what you're feeling.
That's awesome. I mean, I know I've taken a first level craniosacral therapy class by Upledger, and
Yeah.
I am the massage therapist that will dig into you, and I use cupping, and I use just more pressure. That's just my style.
Right.
So I think because of my background and my relationship with massage, it was really challenging for me and I don't feel like I ever had a grasp on that, to be frank.
Yeah.
And I really respect you and the work that you're doing with this because I think it's difficult for some of us to understand and get. And I'm in that category and I don't want to be, but that's okay. That's why we all have our specialties and our niches because, we all specialize in something different and we all have something awesome to provide our patients.
I think
And
I remember sending some deep tissue clients to you back in the day.
yep, I and more than one. I know that. Now, Marni, what got you into craniosacral therapy from your previous massage work? And what did you do energy work before? Have you always done energy work? Have you been kind of give me your progression of what your career has taken you on
Oh,
path?
thank you. Thank you.
Yeah.
I took a Reiki class back in the early 90s before I ever went to massage school. And I thought, well, that's really cool. It feels very relaxing, but there was no big aha. And then I practiced it for about a month and then I forgot about it. And I went to massage school and after I went to massage school, I had a lot of Reiki masters tell me my hands were hot. They told me I was moving energy. I thought, oh, that's really interesting. Pause. And while I was still in massage school, I took a craniosacral class. Now, I was very motivated to take craniosacral because the reason why I became a massage therapist is I really wanted to be an osteopath. And I had had an osteopath that had helped me get out of pain for many years while I worked in an office environment. And I wanted to do that. I wanted to help people who had chronic neck pain like I did and get them out of pain in a gentle way. But I was 40 years old and have a degree in business. And the osteopath that was my family doctor for years while I was in this office environment suggested I go to massage school. And I said, why do I want to rub on people all day? I really thought massage therapy was a luxury service for rich people. And I had had maybe one massage my whole life, right? And she said, well, you can do most of the body work that I do. I was like, oh, really? Sign me up. So I had no idea what I was getting into. I went to massage school. I understood that it was a trade school and I did the thing. I got my license, but they didn't teach me all that stuff. So I immediately started taking every advanced class I could. And I put my shingle out as a medical massage therapist, and I did a good job at it. I did a lot of orthopedic work, a lot of deep tissue work. I was that person that lowered my table all the way as far as it would go so I could use all my body weight and get in as deep as I could. All I wanted to do was to help people get out of pain. But I took this craniosacral class because she had actually suggested craniosacral as a modality for me because it's one that the osteopath practices. They call it cranial osteopathy, but it's very similar. So I did, not knowing much, and I took the craniosacral class, and boy, I approached that class like learning all the details and all the mechanics, and I basically memorized what was taught to me. And I went and practiced that 10-step protocol for the next 4 years. I thought I knew everything, but I did it. I did it, and I trained my hands, and I got really good at feeling the movement of the cranial bones, at feeling the cranial rhythm. I practiced a little bit of craniosacral on every client. It was rare that I did a full session, just cranial at that time, but I practiced it with everybody. And then I finally went back and got some more training. But in between that time, I decided I needed a mentor. And I found a therapist that was working at the same place that I was, who had been practicing for 35 or 40 years. And I asked her, I said, "Can I come and give you a massage?" I was a new grad, and she said, "Okay." So I did. Y'all may know has been my mentor, and she said, "Wow, you've got some talent. I think I can work with you. Would you like to trade with me?" So I fell into this amazing opportunity to work with this really advanced therapist. And every week I spent 2 hours on her table and I worked on her for 2 hours. And she would only tolerate the lightest touch. I thought that I was doing some combination of myofascial release and energy work. Like I would barely touch her and she'd say, "Nope, back off." Like, okay. So I was like just barely touching her skin, but she would tell me where she was feeling this releases in her body. So I would be tracking from working on her foot, releases all the way up her leg, into her pelvis, into her belly, all the way up into her head and even the cranium from working at a distant part of the body. So she taught me this gentle way of unwinding or myofascial release for the entire body. And one day I got home and she had posted on Facebook, "Wow, Marni, that was a great cranial session." And I said, "I didn't even touch your head. What do you mean that was cranial? I thought we were doing myofascial and energy work." And then the light bulb went off, and I finally realized that she had been teaching me craniosacral therapy all these years. And then I did go ahead and enroll and start taking the more advanced classes through the Upledger Institute. But I so I kind of fell into it. And after working with her, I started to develop this hybrid of techniques. I would do some deep work when I needed it, and then I would go into the lighter work, especially for people who could handle it. Especially, I treated a lot of very frail people, a lot of elderly people, and some people that just didn't need super deep work. And I was amazed to watch the changes, the profound changes in their body. And then this really skyrocketed after I started working at Kikino, that I started doing a lot of somato-emotional release, which is where we release emotions or traumas that are held in the body. So anytime there's a trauma or a traumatic event, or it could even be just a story that we told ourselves that I'm not good enough or I'm not worthy or some limiting belief, it's very often that there'll be a part of the body that will hold on to that. And it's not unusual that be called to put my hands on a place on the body and they'll start crying and they'll start releasing. And the beautiful thing is at the end of that, once they cry and once they feel all the emotion that's held there, it's often gone or mostly gone. I'm not going to say that it doesn't come back because that's how healing works in layers, but I will literally look at them and they'll be freer. They'll be lighter. They'll be more comfortable in their bodies. They'll feel more confident. And that just excites me to no end to watch the profound healing that we're able to facilitate.
I mean, that's exactly what we're doing this all for, right? Is to get that, that reward at the end of the session that says, "Man, I feel so much better. Thank you for helping me on my journey of healing."
Right.
And I know that, like, what it may seem like is just small, very, very light movements with big results. And it's pretty amazing to me that, we have these tools that we can use as massage therapists to really provide the best outcome for any person, any body, any situation that, walks in our door. Cause we don't know what's going to walk in. This person could be very traumatized or very anxious or come from, a background of a lot of, disease or illness or emotional trauma. We have no idea what our work is going to do to release in their bodies and how that is going to look for us. Yeah.
That is so beautiful, Julie, and so accurate. And if I could be a little esoteric, I've come to see that spirit has a way of sending the right person to the right therapist at the right time. And the fascinating thing, when people ask me about craniosacral therapy, I tell them that my early work in orthopedic and medical was about evaluating what was wrong and putting it back where it's supposed to go. We don't diagnose, but we evaluate. We don't cure, but we treat. So, if the hips were out of alignment, I'm putting them back into alignment. But with craniosacral therapy, there's this idea of neutrality, that it's not my job to decide what that client needs. It's my job to listen to their inner wisdom, or the inner physician, however you want to describe it. But there's this understanding that every human body knows what it needs to heal. And somehow some magic happens where the right therapist is there at the right time, and we're called to do the work that we are the best able to do for that body. It's like it always matches up. And, we also have resources, and we have people, and we have colleagues that we can refer to. But yeah, it's just fascinating how it always works out.
And it is pretty emotional to think about, because it does feel a little like kismet, like right place, right time kind of feeling.
Yeah.
I mean,
Yeah.
Patients and clients move through our lives just like friends and, and jobs and things like that. Patients and clients move through our life in the same way. I'm very thankful for the people that are surrounding us in our massage community, because our clients' bodies are changing every day. And, I was unfortunate enough to have to go through one of my best friends getting cancer and beating it, by the way. So I'll always,
Wow.
the good story is that she is alive and well and survived and has no cancer in her body now, thank God. But when she was diagnosed with breast cancer, I was fortunate enough to have somebody in our massage community to be able to work with her. Is I am not trained in that, and I don't do no harm, number one rule.
Right.
Especially when it comes to somebody that I really cared so deeply about and love with all my heart. And so I'm just blessed to be able to have Kikino and all the other people in our community that help us heal the community together.
Amen. Yes. Yes. So excited about that, Julie. It really has become a beautiful community. There's plenty of work to go around. Like I don't have this concept of competition. It's really collaboration.
Absolutely. Yeah. Absolutely. And it's just I'm so happy to be I feel like I'm in the middle of it, I just want
You are.
I want to give everybody a big hug and come and, eat and network with us and have classes and learn, and let's be massage nerds together, which takes me to the next class. Let's talk about what you're going to talk about and show us in the pelvis class. And, I've never taken a pelvis class before, a specific class on the pelvis. And I mean, to me, the pelvis looks like a central part of bodily function happens all in the pelvis and sits all in the pelvis.
It's really important. So what occurred to me was the first thing I do in almost every session is evaluate the alignment of the pelvis. I will check to see if the legs are measuring the same length. Interesting fact, it's super rare to have a congenital leg length discrepancy, meaning most people's legs are the same length unless they have some kind of birth defect. But they will measure a different length if the pelvis is out of alignment. So I brought my little pelvis. I don't know if that'll help. But if you imagine, if this ilium is rotated forward and this one is rotated backwards, that's going to shift the whole body. The legs will be a different length. The pelvis will not feel good. The SI joint, the sacroiliac joint, which is this joint on the back where the sacrum and the ilium come together, this joint will be out of whack and cause a lot of pain for people. It will cause a curvature of the spine. It'll often cause problems with the neck, the jaw, the cranium, even the eyes. So in my mind, if I want to get that body into alignment, I have to start at the pelvis. So in this class, it's a very technical orthopedic class where we learn to evaluate and to feel which way is it rotated. Is the ilium forward or backwards or up slip or down slip? And from that, there's a very, very quick osteopathic technique, not high velocity adjustment. It's super gentle. In fact, when I first started learning this technique, I didn't quite believe it was working because it was so easy and so gentle. It was just like, how did that work? So I would have to go back and check it again. So I teach that technique. It came from Dr. Still, who was the founder of osteopathy. It's attributed to him. And if that doesn't work, I have some muscle energy techniques that I'll show as well, with the goal of getting the pelvis into alignment. And it's super easy, super simple techniques, but wrapping your head around which way the pelvis is rotated and which technique to use takes a little time. So that is our focus of the class. In fact, the technique is so fast and so easy that last time I taught the class, I balanced everybody's pelvis during the lecture. So then we brought in I think we had about 30 people from the public that we brought into our class so my students could practice, because practicing on each other wasn't possible.
You already fixed everybody.
Right. And once it's fixed. Now, is it fixed permanently? Probably not, because we have habits and muscle strain patterns. So after that, I would go into doing some gentle cranial work, and we'll introduce that. It's not enough time to really teach the craniosacral work, but one of the things we do is called a pelvic diaphragm release. And that looks like one hand under the sacrolumbar junction and one hand on top on the belly. And from that position, I can feel that rocking motion of the sacrum. And it's also a place to balance the fascia and the energy of the whole pelvis. So we'll introduce that concept, and then we'll really practice it in the craniosacral class. But the whole idea is this is where we start. And this is like the basic. It's interesting because my practice is very much about more cranial and somato-emotional release and esoteric stuff. But this pelvis stuff is fundamental, and it's easy and it's fast. So I'm excited, really excited to bring it to Handcrafted.
I'm excited too, because this sounds amazing. I mean, what a great combination to actually have both in your toolbox, the craniosacral and the pelvis class, because I mean, those are the two most important parts of the body, I think.
The head and the pelvis, yeah. Yeah.
We have to break it down to like and especially the skeletal structure. It would seem like the pelvis and the skull would be the two most important.
I think it's all important, but you're definitely starting with the high points for me. Yeah. If you have that working, then the rest of the body has a better opportunity to get better nerve flow, better energy flow, better lymphatic flow, and to be closer to healing itself. A lot of what we do at Kikino, we call it the primary barrier, which is finding the root cause, the place that's the primary point where the client is holding on to tension or fascia. Where do we need to work? And it's not usually the head or the pelvis, but if I don't have those right, how's everything else going to unwind?
Yeah.
Yeah. So I'm really excited. I'm so excited about this opportunity to collaborate with you.
Oh, thank you. I'm excited too. I hope we get a full happy classroom at Handcraft. As you can see, I'm in the training room. This is
That's beautiful.
My mural on the wall that says judgment-free zone. So we always promote.
Oh, I love that.
Yeah, we always try to remind our classroom participants that you're in a safe space. You can relax and be comfortable, and there's not going to be any judgment on anybody for anything. There's no dumb questions. There's not everybody's a beautiful body. We're all humans. Kindness and grace are always in full supply.
I love that. And if I could just add a little bit, the level that I teach at is really for people who are fresh out of school or who have been practicing for many years. And I go over anatomy like you probably don't remember it. That's the expectation, that you probably forgot the names of those cranial bones, and that's okay. That's where we'll start. I've been to other classes that are amazing, but it was like drinking out of a fire hose, and I had to go in there with all of my anatomy knowledge or I'd be lost. So with this one, I really do try to take you back and do a review so that everybody can understand what we're talking about and walk out of there with some real skills. I want people to walk out knowing what it is that I came there to teach. And we are usually successful at that.
Yeah, in talking to you, Marni, I always love the way that you present things in a way that you don't sound like you're condescending at all, but you speak in layman's terms. And I appreciate that because there's a lot of things I don't remember either about anatomy and physiology and kinesiology and all this stuff that we learned a million years ago in massage school. And, not necessarily use those terms every day. And so I'm just thankful that we have instructors and you're the cream of the crop, honestly. I think that, the communication that you provide in class is very clear and easy to follow and not intimidating or judgmental at all. And I think students would really come in if they've never been taught under you. I think they'd really appreciate that. So if you've not taken a class with Marni, you should definitely sign up for one of these 2 classes at Handcrafted Therapy. And, our partnership with Kikino has been fantastic. I want to throw out that if anybody's out there thinking about attending massage school or want to know more about it, if you're in the Dallas Plano area and interested in finding out more about massage schools and how much it costs and what you need to go through massage school, or just want a tour of the school, go to Kikino. They're on Kessler Road in Plano. And I think it's kikino.com. It's KEKINO.com.
Yes.
1620 Kessler Road. So yeah.
Awesome. I'm honored to be on your call today, Julie.
This has been really fun. I'm just happy to have this opportunity to work with you and really looking forward to the classes. If anybody out there has questions for Marni, please keep them on the comments. Wherever you're listening to this, reach out to us because we love questions. We love interacting with our audience and getting your feedback. If there's something that you want to hear or see at Handcrafted Therapy, let us know. Well, thanks again, Marni. I appreciate it.
Thank you.